originates on your zygomatic arch, it inserts on your mandible, and that's what's going to cause you to close your mouth when you're like chewing food. Okay? The next muscle to be aware of up here is this guy. What's that guy? That's the sternocleidomastoid muscle. It originates on the sternum and on the clavicle, and then it inserts on the mastoid process of the temporal bone, and that's going to cause you to, if one side contracts, you'll turn your head to the side. If both contract at the same time, you'll kind of bite, you'll like flex your head. Okay? What you can't see on this model, and I don't, I think Professor Bolano has it. Unfortunately, I don't, do I have one up here? Oh, well, all right, I kind of got a thing here. Hold on. What's this muscle here? All right, that's the diaphragm. I don't think you'll have a hard time identifying the diaphragm. It's your main breathing muscle. When it contracts, it goes down and you inhale. When it relaxes, it comes naturally back up into place and you exhale. So again, I'd have to cut this guy open to show you that. External intercostal muscles, it's not deep enough on here to show you those, but those are little muscles that run. What does inter mean? Between. What does costal mean? That means ribs. So the intercostal muscles. I'm just looking to see if. Yeah, none of these models have it. You can look on pictures, but the external intercostals run between the ribs. So you'd have external intercostals running like that, all between all of the ribs. Okay, and they run sort of in this direction. And when they contract, they essentially pull your rib cage upward, which also works to expand or increase the size of your thoracic cavity, which pulls the lungs with it, which causes you to inhale. So the external intercostals and the diaphragm, they work together. When they contract, they cause you to inhale. When they relax, you'll naturally exhale. What's this guy here? That's the rectus abdominis muscle. Okay. When it contracts, what do you suppose you're going to do? You're going to flex your trunk, right? Like you're bowing. Okay. So that's that guy. The external oblique is this guy coming in at an angle here. That's also can cause you to flex your trunk. When it contracts, it also can tighten your abdominal wall, which again is going to increase the pressure inside of your abdominal cavity, and that's going to help with pooping and peeing and childbirth and all of those kind of things. Erector spinae, oh, they are on here. I didn't think they were on here. Okay, this is some of the deep muscles I was talking about. Unfortunately, we don't have any models that show this. The erector spinae muscles are deep, deep, deep back muscles. You'd have to cut away all of these other muscles to see it. Okay, but these are the guys that help you sit upright. They extend your spine. They basically are located they're located right sort of in the midline, and they go up and they attach to things like the spinous processes, and then they attach to other spinous processes that are lower down. And so when they contract, if you can picture it, they're kind of pulling everything up and they're causing you to sit upright. Okay? Look in your book. I think there's a better picture in the book. Well, at least there is a picture in the book. All right. Trapezius muscle. That's this guy here. Okay. You can see it's originating off of the vertebrae. It's also originating off of the occipital bone, and then it's inserting on the scapula. You know, it just depends on what you hold steady. It could cause you to extend your head, or it could cause you to shrug your shoulders. Okay? You know, this table here is meant to keep things simple. You know, I put on here that it shrugs the shoulders, but if you put that it extends the head, you know, that would also be right. If you look in your textbook, it gives a lot more detail than these tables do. So, you know, if it's a correct movement, even if it's not listed here, I have to accept the answer. Okay? Serratus anterior. It's over here on the side. Okay? It's these little things coming in like that. You just kind of barely see them. Looks like the serrations of war. Let's see. Yeah, it's showed better over here. Okay, so these little serrations that are coming in. Those are originating on the ribs. They then circle around in back, and they attach to the scapula in back, so that when they contract, they pull the whole shoulder forward, which you would do like in a punching type of a movement when you're pulling your shoulder forward. Pectoralis major, pretty easy to identify. It's this guy. Oops. Originates a little bit on the sternum and on the clavicle, and then it's going to insert on the humerus. And you can kind of picture it. When it contracts, it's going to adduct your arm. It's going to move it closer to the midline. Latissimus dorsi. That's the crazy one that has the big origin, but then the tiny insertion. So this is your latissimus dorsi. It's originating. It actually runs underneath the trapezius. It's originating off of some of the thoracic vertebrae, originating off of some of the lumbar vertebrae, originating off of the pelvic bones and the sacrum, and then it tapers and attaches to a very small insertion site on the humerus. This is your swimmer muscle, so it's going to work to basically pull your arm backward. So it extends the arm, and it also adducts the arm a little bit. It pulls it towards the midline, so it's like back and sort of across. Deltoid, it's your shoulder muscle. It's up there. You can sort of kind of see it's multi-pennate form a little bit, the three parts to it. It originates off of the scapula and off of the clavicle. It then inserts on the humerus, and it's the big abductor of the arm. So it pulls your arm out like that. Okay, let's move deltoid. Okay, fine. Biceps brachii. This is your biceps. Okay, pretty much know that. It's going to originate off of the scapula, then crosses and eventually inserts on the radius, and it's going to cause you to flex your forearm. Triceps brachii. It's on the back. You know what? Here's the thing. For triceps, no, because there's no other triceps. For biceps, yeah, it depends on how nice I am that day. I mean, there is another biceps in your leg that's called the biceps femoris, so maybe it's good to specify. I'll be honest though, I've given points when students have just put biceps without clarifying. I mean, usually I get like some guys in the class, and I say guys, I don't mean to be sexist, but usually like there's a lot of there'll be a few weightlifters in the class, and they won't even like put down the full name. They'll just put like traps, lats, quads. You do that? No. I'm not going to let you get that. I want you to say it out. We have traps, quads, lats. I'm like, all right, fine. I get it. You're a weightlifter. All right. Let's see here. Palmaris longus. Okay. Palmaris longus is shown on this one. Yeah, sort of. This is basically the tendon of the palmaris longus. It's starting up in your forearm. It's actually originating on the humerus, so it actually crosses the elbow joint, and then it goes on and it inserts on the palm of the hand. And so this, like, again, I won't do my stupid wave, but this causes you to wave your hand. Okay. Where else are we? Okay. Triceps. Okay. Palmaris. Okay. Iliopsoas. This is another one that you really can't see. Do I have a good? I guess I could try to eviscerate one of these models. Hold on a second. Does this little guy show it? It'd be nice if I could get away. Oh wait, hold on. Oops. Oh, okay, this will show it. Hold on, let me bring this guy up. The iliopsoas is like inside of the pelvis. So you kind of gotta to see it. You kind of gotta take the intestines out and stuff and move things around, but here. I think this model shows it. Uh-oh. Never actually taken this one apart. Maybe it's not. Oh, it's okay. All right. Here they are. So this is the iliacus. This is psoas major there. So together they call this the iliopsoas. It's originating off of the iliac crest and off of some of the lower lumbar vertebrae. It then goes down, it crosses over, over your pelvic bone, and then it inserts on the femur, so that when it contracts, it pulls your femur up. It causes you to flex your femur. Okay. So it's the big one. It's these two guys are the big flexors of your femur. Let's see here. On the back side, now I can go back to my other model. On the back side is the gluteus muscles. And the gluteus muscles are the big extensors of the thigh. So here's your gluteus maximus. Tensor fasciae latae is this guy, this weird one on the side here. Okay. Starts up here, and then it's got this sort of big, thick tendon. Okay. When it contracts, it's going to abduct your thigh. It's going to move your thigh away from the midline. The antagonistic muscle to that is, and by the way, that's kind of how I organized it. If you didn't figure it out on here, at least where possible, I tried to give muscles kind of together, listed one, and then I listed its antagonist. That's sort of what I was trying to do. The antagonistic muscle to that would be this guy here. This is the, let me go in closer. Really? Hold on a second. Get that up. There we go. This here is the adductor longus. So this adducts the thigh, whereas the tensor fasciae latae over here abducts the thigh, moves it away from the midline. Okay, sartorius, this is kind of a cool muscle. The sartorius muscle originates off of the anterior superior iliac spine. It crosses diagonally across the thigh, and then it inserts on the tibia. So it's crossing the hip joint, and it's crossing the knee joint. And when it contracts, it does two things. It causes you to adduct and flex your leg at the same time. You use this muscle like when you're going to sit down. I would used to call it Indian style, but that's not PC anymore. I guess they call it crisscross applesauce style. That's what my kids tell me. My kids know about weed, but now they have a proper way to say like sitting down. So anyway, whatever. That's that. Let's see, sartorius, so that's the sartorius. Oh, by the way, sartorius comes from a Greek word, sartor or something like that. It means tailor. And so I guess somebody looked in and said, hey, that's tailor-made to perfectly fit your leg. And they said, okay, let's call it the tailor muscle. And they said, no, that's too easy. Let's call it sartorius. All right. Quadriceps is 4 muscles. Each one has a different name, and together they call them the quad. So the main muscle making up the quad is the rectus femoris, which is this one. But then on the side, you have the vastus lateralis. On the medial side, you have the vastus medialis. And if you could peel back the rectus femoris, underneath you have the vastus intermedius. So all 4 make up the quad. The quad is the big muscle that extends the leg. Okay, it makes you kick. The rectus femoris, because it actually originates up off of your pelvic bone, it will actually cause some flexion of the thigh. So it'll also do what the iliopsoas muscle does to some extent. Biceps femoris is on the back. It's one of your hamstrings. The biceps femoris is lateral. And then medial, you have what's called the semitendinosus. These guys are your hamstring muscles, and their big thing is they flex the leg, so they're going to bend your knee joint, but because they also originate off of your pelvic bone, they cross the hip joint, so they actually extend at the hip joint. So they extend your thigh, but they flex at the knee joint. Okay. Tibialis anterior is, let's see, which one should I use? That doesn't really matter. This is your tibialis anterior here. It goes down, inserts on the first cuneiform. When it contracts, it causes dorsiflexion. On the back side, you have your gastrocnemius muscle. Goes down via the Achilles tendon. It inserts on your calcaneus. When it contracts, it's going to do plantar flexion. So that's pretty much it. I mean, I know it probably seems a little overwhelming. Any questions about this?